Hello, everybody. Thank you so much for joining me today. My name is Krista Reeves, and I'm here to talk to you today about a product and a modality that I really like and I use a lot in practice, and it's called Kinesiotape. So, what we're going to do today is I have a little brief overview for you. I want to provide you with a little bit of education on the modality, and then I'm going to finish up with a pre recorded video that I have of a Kinesiotape application. So, let's jump right in. Kinesiotape was invented by a Japanese chiropractor named Dr. Kenzo Kase in the early 70s. And so this is the only tape that really allows for full range of motion, and it can be used across the lifespan. So you can tape an infant, you can tape a 105-year-old patient. And it's meant to facilitate, and it can be combined with other therapies. So you can use the tape as an adjunctive prior to setting somebody up for Therex. And another really interesting thing about Kinesiotape is the color therapy concept behind it. So for example, you'll see blue tape, and you would use a piece of blue tape in the same location or for the same reasons that you would use an ice pack for somebody. And then red or pink tape, same concept. So an area that you would heat, you would use the pink tape for. Some of the properties of Kinesiotape and what really sets it apart from other products that are out there on the market are the stretch and recoil technology. And so I'm not sure how well this will translate on screen, but if you can see those wavy lines within the tape, that's the stretch and recoil technology. So what that means is as you stretch the tape and then apply it to the skin, it'll bounce back. And what that does is it lifts up on the skin and creates more space for fluid to flow through. It's waterproof, it's made from cotton, it's latex free, and it allows for full range of motion. So like I said, the theory behind the tape is that it lifts up on the skin and creates space for fluid to flow through. And so it takes the pressure off of those pain receptors, and it allows the lymphatic system to drain more freely. And so now I have a really nice illustration for you. So you can see in the before picture that everything's really, really compressed. And in the after picture, once the tape is applied and everything's lifted up, it's uncompressed, or decompressed, I'm sorry. And you can see that the pain receptors and the fluid and the inflamed muscles and everything in there just has more space to be able to relax the muscle and for the improved range of motion and decreased pain to occur. When to tape. So it's some indications. You want to improve fluid circulation, you want to improve range of motion, you want to prevent injury, things like that. Those are reasons to tape. Reasons not to tape would be if somebody has cancer, cellulitis, open wounds, or DVT. And you would want to use caution if you're taping somebody who's had a previous skin reaction, kidney disease, diabetes, or CHF. There are lots of different taping techniques out there. The one I'm going to show you today is the eye strip. And the eye strip looks like this. And you would typically use it for acute muscle injuries, although it can also be used for chronic. You would just change the amount of tension that you put on. You would also use this for really elongated muscles. So an example of this would be those erectors in the back. They're really long muscles and they do a lot of work. So you would want to use an eye strip for those. And you can use between 35 and 50% tension on those. And so again, tension is just the amount of stretch that you're putting on the tape. So you can see this is what a Y strip would look like, an X strip, and a fan cut, and then a donut cut. And so what I'm going to do is I'm going to show you a quick video. So this is actually my son. My son fell on the playground and he cracked his clavicle. And so his posture was really off because of the pain that he was having. He was in a really protective state. And so what I needed to do was find a way to get him to relax so that that injury could heal properly. And he wasn't using his sling. He wasn't being cautious about his injury because at the time he was an 8-year-old boy. So kinesiotape was my best option. So what I needed to do is put him into position. And the way you do that is you elongate the muscle. So I tilted his head and rotated it so that that upper trap muscle was nice and long. And the reason for that is because then when you put the tape on, it's not going to restrict his range of motion because he's already on max range. So lie the tape down, stretch it out, and then you rub. And that rubbing action is what's going to make the tape stick because it's heat activated. And then that's it. That's all we had to do. And that lasted him for maybe 2 days. I mean, he was very active, so the tape doesn't last as long on somebody who's active like that. But it was the best option for him as my patient. So that concludes my presentation on kinesiotape. Hopefully you walk away from here today with some basic information, some basic education, what kinesiotape is, when to tape, when not to tape, what are some of the properties that makes kinesiotape what it is, and then you have that little demo on how to apply an eye strip. So hopefully you can walk away today and you can try to utilize this in practice. So thank you so much for your time. I really appreciate it, and I look forward to working with you in the future.